Being a medical worker in Sudan is challenging. Hospital staff say they often work in poor conditions and even face risks to their lives. Dr. ABDELHAMID says he has narrowly escaped after being shot at by a relative of a patient in this hospital in Khartoum a few weeks ago.
We received a patient in the ER, so I rushed to rescue him, carrying with me all the necessary resuscitation equipment. To my surprise, the person escorting him pulled out a gun and shot at us inside the ward. The unit was full of patients, their families and medical crews. This is unbelievable. I am totally surprised.
The relatives of patients say the reasons behind attacks like this have to do with negligence on the part of doctors.
If a patient is brought into the hospital and is not attended to by any doctor or nurse, do you expect me to not assault such a doctor, the hospital staff, the director of the hospital, and even the director of the health department?
Doctors say they are being punished for the lack of medicine and proper equipment in government-run hospitals.
One patient needed surgery and his chest cut open, but when they decided to transfer him to the Al-Shab hospital, where chest-related cases are treated, there was no ambulance to take him. In the end, the patient died. May he rest in peace. The doctors were so upset. What can a doctor do in a situation like that?
Sudan's doctors have been protesting over working conditions for years as the attacks against them continued. The health ministry says it's working to address the problem, and the government has promised to provide the needed equipment to the hospitals. But many doctors say the situation is not getting better and they're losing patients. Hundreds of them have launched a nationwide strike. They're demanding an end to physical attacks and want the government to improve what they describe as their miserable salaries and working conditions. Mohamed, Vall, Al Jazeera.